Good afternoon, Mom. So for today's video, I am going to discuss about the natural and artificial methods of contraceptions. So first, we tackle about the artificial methods. These methods is using any instruments or mga bagay na ipinapasok dun sa genitalia, pills or any chemicals. The first one is the oral contraceptives. It is known as the pill. Oral contraceptives contain synthetic estrogen and progesterone. Estrogen suppresses the follicle-stimulating hormone, and LH to prevent ovulation. Progesterone decreases the permeability of the cervical mucus to limit the sperm's access to the ova. It is suggested that the woman takes the first pill on the first Sunday after the beginning of a menstrual flow or as soon as it is prescribed by the doctor. Take note that hindi po tayo pwedeng gumamit ng oral contraceptives if hindi po prescribe sa atin ng doktor. Meaning, kailangang may prescription bago tayo gumamit ng oral contraceptives. So, there are positive and negative sides of contraceptive pills. First, does not interrupt sex. Makes menstruations regular, less painful and lighter. Reduces risk of cancer. Reduces symptoms of premenstrual syndrome. Sometimes reduce acne. And last, may protect against pelvic inflammatory disease. So if there is positive, there is negative sides. First is spotting or bleeding during menstruation, sore breast, nausea, headaches, and weight gain. These are the side effects of oral contraceptives. In non-severe, headache, dizziness, breast tenderness, nausea, breakthrough bleeding, decreased libido, mood swings. And the severe are blood clots, kidney stones, pulmonary embolism, emotional problems, heart attack, deep vein thrombosis, gallbladder problems, and stroke. Then the second one is the transdermal patch. The transdermal patch contains both estrogen and progesterone. The woman should apply one patch every week of 3 weeks in the following areas: upper outer arm, upper torso, abdomen, or buttocks. At the first week, no patch is applied because the menstrual flow will then occur. If oral contraceptives have advantages and disadvantages, transdermal patch also. The first advantages is effective and reversible. Regular, lighter periods, less PMS and cramping, reduced risk of cancers, less ovarian cysts and benign breast conditions. And the disadvantages are no STI protection, less effective if over 198 pounds or 90 kilograms. The possible side effects of transdermal patch are breast tenderness, BTB, headaches, and nausea. Risk of blood clots, possible skin irritation, need a prescription. Patch may full of less than 2%. The third one is the vaginal ring. It releases a combination of estrogen and progesterone as it surrounds the cervix. This silicone ring is inserted into the female reproductive organ and remains there for 3 weeks, and then remove on the 4th week as menstrual flow would occur. The woman becomes fertile as soon as the ring is removed. So there are advantages and disadvantages of vaginal ring. Advantages. First, it is effective and reversible. It is used once a month. Makes periods more regular or lighter. Does not interfere with sex. It is similar benefits as the birth control pills. And the disadvantages are no STI protection, need a prescription, ring may fall out or uncommon. It may cause vaginal discomfort or irritation. However, there are possible side effects of vaginal ring. First is the spotting or bleeding, nausea, headaches, or etc. The fourth one is the subdermal implants. Are two rod-like implants inserted under the skin of the female during her menses or on the 7th day of her menstruation to make sure that she will not get pregnant. The implants are made with etoposide, desogestrel, and progestin and can be helpful for 3 to 5 years. So, the following are the advantages and disadvantages of subdermal implants. Advantages. First, effective, long-lasting, reversible. Simple implantation procedure. No estrogen side effects. Decreased menstrual flow or cramping. And the disadvantages are expensive implantation fees, arm pain, painful removal, possible scarring, irregular bleeding, or cramping. However, the possible side effects of subdermal implants are headaches, nausea, dizziness, weight change, rash, acne, hair growth or loss, and also vision problems. The fifth one is the hormonal injections. It contains a medroxyprogesterone, a progesterone that is usually given once every 12 weeks intramuscularly. The injection causes changes in the endometrium and cervical mucus and can help prevent ovulation. Also, hormonal injections given through a shot by a physician monthly or once every 3 months, up to 99% effective. And there are advantages and disadvantages of hormonal injections. Advantages: simple and easy to use. Less bleeding and cramping during cycle. Less chance of PID or pelvic inflammatory disease. And also, the disadvantages are may cause irregular bleeding and scheduling doctor's office visits. The sixth one is the intrauterine device. It is a small, T-shaped object containing a progesterone that is inserted into the uterus via the female reproductive organ. It prevents fertilization by creating a local sterile inflammatory condition to prevent implantation of the zygote. The IUD is fitted only by the physician and inserted after the woman's menstrual flow. This device can be effective for 5 to 7 years. The following are the advantages and disadvantages of IUD. Advantages: immediately effective, longest lasting of any methods, easily removed by provider at any time, requires no daily attention. Convenient, no action needed before, during, or after sex. Only safe for those not at risk for STDs. And also the disadvantages are doesn't prevent against STDs, requires health care provider visits for insertion and removal. Possible risk to future fertility. For some, insertion can be painful. And last, may increase cramps and bleeding during monthly periods. The seventh one is the chemical barriers. Chemical barriers such as spermicides, vaginal gel and creams, and glycerin films are used to cause the death of sperms before they can enter the cervix and to lower the pH level of the female reproductive organ, so it will not become conducive for the sperm. These chemical barriers cannot prevent sexually transmitted infections. So the following are the cons and pros of chemical barriers. First, you have to remember to use them every time you have sex. Spermicides can be messy. Some people feel like condoms interfere with sensation and ruin the mood. Some people are allergic to spermicides, which rules out diaphragms, cervical cups, and certain condoms. They're effective, but not as effective as non-barrier methods. And also, the pros are you can use them as needed, unlike CN IUDs that it's for the long haul. Most barriers are available without a prescription. Those that require a prescription are talking to you, cup and diaphragm are reusable. You can often get condoms and spermicides for free at a clinic. Barriers are non-hormonal and can be used by everyone. They're safe to use while breastfeeding. They don't impact pre-existing medical conditions like high blood pressure. They're less expensive than hormonal birth control methods. And if you have sex, condoms offer the best protection against STIs during PNV, sex and anal sex and oral sex. The eighth one is the diaphragm. It is a circular, rubber disc that fits the cervix and should be placed before coitus. Diaphragm works by inhibiting the entrance of the sperm into the female reproductive organ, and it works better when used together with a spermicide cream. The diaphragm should be fitted only by the physician and should remain in place for 6 hours after coitus. The following are the advantages and the disadvantages of diaphragm. Advantages: it increases spontaneity, some STI and PID protection, reduces risk of cervical dysplasia and cancer, does not affect hormonal levels, relatively inexpensive. And also, the disadvantages are physician fitting and prescription. Insertion and removal involves touching the genitals. It increases the risk of toxic shock syndrome and urinary tract infection and postcoital drip. The ninth one is the cervical cup. It is made of soft rubber and fitted on the rim of the cervix. It is shaped like a thimble with a thin rim and could stay in place for not more than 48 hours. Using cervical mucus method promote fertility doesn't pose any risk. Likewise, using the cervical mucus method for birth control doesn't pose any direct risk, but it doesn't offer protection from sexually transmitted infections. The 10th one is the male condoms. It is a latex or synthetic rubber sheet that is placed on the erect male reproductive organ before penetration into the female reproductive organ to trap the sperm during ejaculation. It can prevent STIs or sexually transmitted infections and can be bought over the counter. Male condoms have an ideal fail rate of 2% and a typically fail rate of 15% due to the break in the sheet's integrity spilling of semen. The following image shows that on how to properly put on a condom. First, wait for your penis to become fully erect. Then, carefully tear open the condom package. Then, place the condom on your penis while pinching the tip of the condom to remove air and leave space for semen. And lastly, roll the condom all the way down your penis. Smooth out any air bubbles. However, there are advantages and disadvantages of male condoms. Advantages: easy to buy, inexpensive, full personal control over use, no special procedures or exams. Side effects uncommon. Helps prevent pregnancy and most STDs. Can be used with other methods. And also the disadvantages are can sometimes break, need to plan ahead, have available when you have sex, latex and or spermicide allergies. Other brands or types of plastics available for those who suffer, and loss of sensation. Condoms have no side effects. Most people can use condoms with no problem. There are no side effects. Rarely, latex or rubber condoms can cause irritation for people with latex allergies or sensitivities. And sometimes, the lube on certain types of condoms may be irritating. The 11th one is the female condoms. These are made of a latex rubber sheets that are pre-lubricated with spermicide. They are usually bound by 2 rings. The outer ring is first inserted against the opening of the female reproductive organ, and the inner ring covers the cervix. It is used to prevent fertilization of the egg by the sperm cells. The following are the advantages and disadvantages of the female condom. Advantages: available without a prescription. No hormonal side effects. Can be used for people with latex sensitivities. Prevents STDs, chlamydia, gonorrhea, herpes, HPV, and HIV. Stays in place regardless of penis hardness, cannot fall off. And also the disadvantages are difficult to use, can break or leak, more expensive than the male condom, does not contain spermicide. There is no physical side effects, and there is a chance though that it will break or slip during intercourse. Take note that do not use with male condom. The friction will cause both to break. Lastly, the surgical methods. During vasectomy, a small incision is made on each side of the scrotum. The vas deferens is then tied, cauterized cut or plug to block passage of the sperm. The patient is advised to use a backup contraceptive method until 2 negative sperm count results are recorded, because the sperm could remain viable in the vas deferens for 6 months. In women, the tubal ligation is performed after menstruation and before ovulation. The procedure is done through a small incision under the woman's umbilicus that targets the fallopian tube. For cutting, cauterizing, or blocking, to inhibit the passage of both the sperm and the ova. The following are the advantages and the disadvantages of surgical methods. Advantages: high effectiveness, permanent, allows for spontaneity. And also the disadvantages are expensive, irreversible surgery, and no STI protection. Surgical methods are used widely throughout the world. And those are the artificial methods of contraception that I haven't told you. Meron tayong oral contraceptives, transdermal patch, vaginal ring, subdermal implants, hormonal injections, intrauterine device, chemical barriers, diaphragm, cervical cup, male condoms, female condoms, and surgical methods. So next, we tackle the natural methods of contraception. The natural family planning methods do not involve any chemical or foreign body introduction into the human body. People who are very conscious of their religious beliefs are more inclined to use the natural way of birth control, and others follow such natural methods because they are more cost-effective. So the first natural methods of contraception is abstinence. This is natural methods involves refraining from sexual intercourse and is the most effective natural birth control method with ideally 0% fail rate. It is the most effective way to avoid STIs or sexually transmitted infections. Most people find it difficult to comply with abstinence, so only few use this method. The following are the advantages and the disadvantages of abstinence. Advantages: the effectiveness 100% prevents sexually transmitted infections and pregnancy. No medical or hormonal side effects. Postpone emotional and physical risk. Least likely to become infertile. And also the disadvantages are may be difficult to abstain and may not be prepared with backup method if or when you choose to become sexually active. The second one is the calendar method. This method is also called as the rhythm method. It entails withholding from coitus during the days that the woman is fertile. According to the menstrual cycle, the woman is likely to conceive 3 or 4 days to record her menstrual cycle for 6 months in order to calculate the woman's safe days to prevent conception. The following are the advantages and disadvantages of calendar method. Advantages: most useful when combined with basal body temperature or cervical mucus method, and expensive. And also the disadvantages are not very reliable, requires accurate record keeping, requires compliance with abstinence during fertile periods. The risk of calendar method are pregnancy, STIs, and ovulation time can change. The third one is the basal body temperature. The basal body temperature, or BBT, indicates the woman's temperature at rest. Before the day of ovulation and during ovulation, basal body temperature falls at 0.5 degree Fahrenheit. It increases to a full degree because of progesterone and maintains its level throughout the menstrual cycle. The woman must record her temperature every morning before any activity. A slight decrease in the basal body temperature, followed by a gradual increase in the basal body temperature, can be a sign that a woman has ovulated. The following are the advantages and disadvantages of basal body temperature. Advantages: inexpensive, convenient, no side effects. And the disadvantages are reliability can be influenced by many variables: stress, fatigue, illness, alcohol, warmth or coldness of sleeping environment. And also, the risk of basal body temperature is pregnancy. The fourth one is the cervical mucus method. The change in the cervical mucus during ovulation is the basis for this method. During ovulation, the cervical mucus is topous, thin and watery. It also exhibits the property of spin barget, wherein it can be stretched up until at least 1 inch and slippery. So here are the advantages and disadvantages of cervical mucus method. First, advantages. Self-evaluation can be very accurate. Self-evaluation can be diagnostically helpful. Start of ovulation while breastfeeding. Commencement of menopause. Planning desired pregnancy. And the disadvantages are uncomfortable touching genitals and mucus. Doesn't protect from STIs. However, the risk of cervical mucus method are inaccurate if mixed with semen, blood, contraceptive foams, or discharge from infections, and pregnancy. The fourth one is the symptothermal method, a combination of the BBT method and the cervical mucus method. The woman records her temperature every morning and also take note of changes in her cervical mucus. She should abstain from coitus within 3 days after a rise in her temperature or on the 4th day after the peak of a mucus change. The symptothermal methods are associated with side effects, particularly in combination with other medications and tobacco, and health complications including mood changes, acne, headaches, breast tenderness, pelvic pain, excessive bleeding, amenorrhea, nausea, weight gain, and uncommonly blood clots. The fifth one is the ovulation detection. The ovulation detection method uses an over-the-counter kit that requires the urine sample of the woman. The kit can predict ovulation through the surge of luteinizing hormone that happens 12 to 24 hours before ovulation. So here are the pros and cons of ovulation predictions. Pros: relatively easy to use. Tells you when ovulation is approaching. Does not need to be used right when you wake up. More comfortable alternative than checking for cervical mucus. And the cons are can get expensive. Difficulty of reading a positive test result. May not work well for women with PCOS. May yield false positives and can't always confirm when ovulation will happen. The following images shows the possible effects of ovulation detection. First, hot flashes, bloating, weight gain, mood swings, nausea, headaches, breast tenderness, and blurred vision. Lastly, the coitus interruptus, one of the oldest methods that prevents conception. A couple still goes on with coitus, but the man withdraws the moment he ejaculates to emit the spermatozoa outside of the female reproductive organ. The disadvantages of this method is the pre-ejaculation fluid that contains a few spermatozoa that may cause fertilization. So, the following are the advantages and disadvantages of coitus interruptus, or withdrawal. Advantages: possible choice for monogamous couples with no other option for birth control. Religious convictions opposed to use of birth control. Disadvantages: one of the least effective methods of contraception. No protection from STIs. However, the risk of coitus interruptus are pregnancy, male partner in control, and leakage of fluid prior to ejaculation. And those are the natural methods of contraception. And I'll hope that you will learn something from my discussion. And that would be all. Thank you and God bless.